Alrighty, today what we're going to do is continue with our rehabilitation of the low back. These are phase 2 type exercises. Before we were working on stretching, now we're working on strengthening the low back. So Haley, I'm going to have you do the walking dog. I'm going to have you get down on all fours just like that. Make sure your arms are perpendicular, make sure your legs are perpendicular, make sure you have a nice flat, strong back. I'm going to have you lift this arm up. And now what we're going to do is lift up the opposite leg. What it does is causes her body to balance out. It's strengthening the low back muscles and it's strengthening her core. You want to hold this for as long as you can, 5 to 10 seconds, and then you're going to switch sides, same thing. What we typically do in our clinic is 3 sets of this. So she's going to do this to exhaustion. Take a break, Haley, and then we begin a whole new set. At the beginning, you really want to concentrate on your form because that's the most important part. If it's easy, more than likely you're cheating, and if you're cheating in this, you're not strengthening the low back, which was causing your problems. The next exercise we're going to do for phase 2 exercises are planks. They're pretty simple. We'll start it off on our knees, and then we'll work to a little bit harder one. So Haley, I'll show them how we do planks off our knees. And we're going to drop down to our elbows. Good. We're going to bend slightly back just like that. So that way it creates some pressure in the core. And she's going to feel it. She's going to hold it for as long as she can. And then Haley's going to drop down and take a break. And then Haley, when she's feeling rested, she's going to pop up and she's going to try that 2 more times. As you can see, her knees are touching, her glutes are pretty much level with her scapula, her arms need to be a little bit more perpendicular, and we're good. I'm going to have you come up, Haley. Again, just like the last exercise, if it's easy, you're probably not doing it correctly. Use a mirror and try to figure out where you're going wrong, because if you're cheating, you're just cheating yourself. Haley, this time we're going to do a true plank, so I'm going to have you on your elbows again. Feet out, knees off, good. Arms are perpendicular, her glutes are parallel with her shoulder blades. She's going to do this for as long as she can, 5 to 10 seconds, and then she's going to take a break, and then she would do 2 more sets of that. You can usually start off with your knees for a week to build up some core strength, and then work your way up to that about following a week. These are the exercises we do at our clinic. These are phase 2 exercises. We first try to get some good stretching and range of motion exercises. Once we can get those done without any end of range motion pain, we move on to these exercises. Thank you.